So good afternoon, good morning, good evening to everyone, and thank you for joining us today. My name is Catherine Laverty. I'm the Communications and Policy Director here at the Global Self-Care Federation. I'll shortly be handing over to our Director General, Judy, who will moderate today's session and introduce the different panelists that we have on board. So we're looking forward to a really interactive session talking about trust in the consumer health industry and really how the industry is evolving. This webinar also forms part of our 50-year anniversary, where we're really thinking about the future of self-care and what the next 50 years will bring us. Before we get into the webinar, just a couple of practical things. We will have time for a Q&A. If you do have questions, please write them in the Q&A box and not in the chat box. And also there will be an opportunity for you actually to speak to those questions as well. So now with that, I'll hand over to Judy and we'll get started with the webinar. Thank you.
Hello, everyone. Good afternoon. It is here in Europe, and good morning and even good evening to you all. A big welcome and Happy New Year as well. We're delighted to have as our media partner for this session, HBW Insights, and we thank them for their contributions and also for their promotion as well. Trust. It's central to the self-care industry, and it's a key determinant of a successful self-care delivery. Individuals need to trust the information they're receiving. They need to know it's reliable, it's accurate, and they need to know the products they use are appropriate to treat their conditions. This event, what we're going to talk about today, about how we can increase trust in the self-care industry and highlight some of the challenges and opportunities in this post-COVID world, the role of regulation in driving varying levels of trust globally, and the digital health landscape as well, and how this affects consumer trust. And also looking at how we can strengthen it, strengthen trust as a group. So I'd now like to introduce our panelists, who you'll hear from shortly. We have David Ridley, who is the Senior Editor of HBW Insights. And we have Manoj Raghunadandan, who is the Global President for Self-Care OTCs and the Office of Marketing Value, Johnson & Johnson Consumer Health, and a board member of ours. Sandra Macleod, who is the Group CEO of Echo Research, who conducted our trust audit for us last year, and Chris Moose, who is the Partner of Life Sciences and Healthcare at IBM. So you'll hear more from those people in a minute. We'll move on to the next slide. Thank you. What I'd like to do now is just spend really 1 minute on who we are, for those who don't know, and a little bit about our trust audit, and then we'll go straight into it. So the Global Self-Care Federation, we represent associations and manufacturers in the self-care industry, and we're committed to promoting sustainable growth and better health outcomes for all. We aim to be the go-to source of self-care information for healthcare professionals in particular, and we work closely with our members and stakeholders to help deliver better choice, better care, and better value. We have been in official relations with WHO for many, many years now, and we work with them on, or with them in various areas from NCDs, traditional and complementary medicine, AMR, etc. And we work with them through a lot of their committees as well to help drive responsible self-care and self-medication. Next slide. Okay, so self-care. There are varying, definitions out there. The one that we ascribe to is the WHO definition about self-care, referring to holistic activities, practices, and products that can include medicinal, device, and nutritive products that a person can adopt to improve their health and well-being, with or without the aid of a healthcare professional. So that can involve lots of things, from just making healthy lifestyle choices, avoiding bad habits, making responsible use of prescription and non-prescription medicines, being able to recognize symptoms and monitor symptoms as well. And really what we're trying to do is get people to be active and engaged self-managers of their health. So, as I said, last year, we conducted a trust audit or trust survey, a global survey, with the help of Echo Research, and you'll hear from Sandra in a minute. So we looked at a whole lot of different areas, if you like, and what we really wanted to know was what's the landscape look like and what's driving trust or not driving trust across a whole range of areas. So what we found is consumer trust in self-care, in the industry and in products is generally very high, but there's about 1/5, let's say, of healthcare professionals who may mistrust parts of self-care in the industry. So that's something that we found particularly interesting. Next slide. And then when we looked at the regions, we looked at self-care across self-care industries across the regions around the world. And what we saw that was the self-care was really the most trusted, if you like, in Europe and then North America, and the least trusted in regions such as Africa. And we believe this is related to Europe having strong regulatory frameworks and, of course, weaker regulatory frameworks in Africa. And we know that having strong people seeing strong regulatory frameworks really helps to give people confidence in the industry and in the products that they're purchasing. Next slide. So looking at some of the trust drivers, if you like, that we found, product safety, efficacy, regulation, and societal benefits were seen as really positive attributes of the industry, of the self-care industry. And there were probably only limited concerns, but some of those were around irresponsible marketing in some regions. That was really one of the biggest concerns, but albeit in a limited way. So that's just like a really high overview of the audit, because it was really a big piece of work and an interesting piece of work. So let's go to the next slide. Okay, now I'd like to hand over to David Ridley, our senior editor from HBW Insight, talking about challenges, opportunities for building trust in a post-COVID world. Over to you, David.
Thanks, Judy. And thanks to GSCF for inviting HBW Insight to co-host this important event, and to everyone for coming. Before the coronavirus pandemic, people across the world have been losing faith in experts and in their political representatives. Commentators insisted that we'd entered a post-truth era, and even mainstream political figures were regularly accusing journalists of propagating fake news. During the pandemic, however, trust in experts has returned, with individuals and families relying on healthcare professionals and high-profile scientific advisors for advice on how to take care of themselves and avoid infection. With the unprecedented speed of COVID vaccine development and approval, science-based medicine is enjoying something of a renaissance in the public eye. Trust in consumer health products also remains high, according to the recent GSCF survey that Judy just outlined. 3/4 of consumers said they trusted the self-care industry, with OTC medicines ranking as the second most trusted sector for both consumers and professional stakeholders. But the road hasn't been smooth for industry during the pandemic, with troubling incidents related to OTC products, such as unfounded concerns about non-steroidal anti-inflammatories, as well as predatory companies marketing supplements as offering protection from COVID. As the pandemic swept across Europe in March, OTC NSAIDs like ibuprofen were suspected of aggravating COVID-19 infection, with French Health Minister Olivier Véran advising people that they should take paracetamol for fever instead. A series of falsehoods disseminated via the social media platform WhatsApp were found to be the source of the ibuprofen scare. The European Medicines Agency intervened, pointing out that there was currently no scientific evidence establishing a link between ibuprofen and worsening of COVID-19, and urging people to continue using NSAIDs like ibuprofen as per approved product information. At the same time, internet advertisements began springing up for numerous consumer health products claiming to be COVID cures and treatments. Media reports and some academic publications had suggested that supplementing with vitamin C and D, particularly at high doses, could reduce the risk of COVID-19. Again, regulators had to intervene, with the UK's National Institute for Health and Care Excellence warning that there was not enough evidence to support taking vitamin D solely to prevent or treat COVID-19. One of the major factors driving all this confusion has been consumers' increased reliance on online information and e-commerce, combined with a low level of health literacy among the public. Many of the 34,000 counterfeit products claiming to be effective against the coronavirus seized by Interpol in March were advertised on the internet. HPW Insight has taken a keen interest in this subject. Many of the experts we've interviewed during the course of the pandemic have pointed out that the quality of health information on the internet is extremely uneven. And as we all know, the world is full of scammers ready to prey on people's worst fears. International industry bodies like GSCF and the Association for the European Self-Care Industry have called on companies to take a more proactive approach to improving consumers' health literacy and to be leaders in responsible advertising, for example on social media, and provide accurate and helpful information about their products online. Many big players have already stepped up to the plate. J&J, Bayer, GSK, P&G and Nestlé are all founding members of the Global Alliance of Responsible Media, which brings together 16 of the world's leading advertisers with a common goal of rapidly improving digital safety. It's clear that industry's primary vehicle for conveying health information to consumers is through its established brands, which have built up high levels of trust over decades, thanks to their safe, effective and science-based solutions for minor ailments. It is these household brands that consumers rushed to stock up on as the pandemic swept across the world. While advertising and brand websites have a key role to play in building trust, industry has recognised the value of pharmacy in conveying important health information to consumers. Last year, GSCF launched a statement with the International Pharmaceutical Federation, which argued that pharmacists play a key role in assisting individuals as they can provide unbiased, evidence-based advice and information about regulated or evidence-based self-care products and services available. Especially during the pandemic, consumers appreciated having qualified professionals they could turn to for health advice without having to make a doctor's appointment. Alongside consumer health companies, pharmacists are often ranked as the most accessible and most trusted healthcare professionals by members of the public. One of the challenges of companies working in partnership with pharmacy during the pandemic is how best to communicate with pharmacists about new products and marketing campaigns. Many firms are finding new ways to engage with these frontline healthcare professionals through digital apps or QR codes, for example, which can be used by pharmacists to provide socially distanced and touch-free consultation about self-care products. At HPW Insight, we continue to report on how the ongoing pandemic is shaping the consumer healthcare industry, creating new opportunities in areas such as immunity, probiotics, and CBD. But it is clear from our work that if industry is to continue to thrive, building and maintaining trust in consumer healthcare products must be top of mind. Thanks for listening. Back to you, Judy.
Thanks, David. There's some really interesting points there, and we can pick up on those later. Catherine, we're going to do an audience poll now before we go into the panel.
Yes, thank you, Judy. So really, before we delve into the panel discussion, we wanted to just do a quick pressure test and really see what the audience's perceptions were concerning trust and the self-care industry. And we thought that this would also inform discussions moving forward. So I'll launch a polling now. And would just ask everyone to give their responses in terms of the three questions asked. So firstly, do you trust the self-care industry? Yes, no, or neutral. Secondly, has the pandemic improved your perception of self-care? Yes, no, or neutral. And then thirdly, in your opinion, what's the best way to improve trust in self-care? And this is a multiple choice. So consumer education, awareness, ethics and regulation, transparency. So we'll just give you a few more seconds before we end that polling, just so you can give your input there. Perfect. So I think we can finish that now. So as we can see, a strong number of people having trust in the self-care industry, 83%, which is good, and just 1% not having trust in the industry, which is a good result. Secondly, has the pandemic improved your perception of self-care? 63% said yes, 13% said no, and then 24% were neutral, either agreeing or disagreeing. And then in terms of what's the best way to improve trust in self-care, quite a mix of answers. It seems that the majority of people favoured consumer education, improving transparency, ethics and regulation, and then lastly, awareness. So I'll share those results with you now. So you should see those results in front of you. And I think with that, I'll turn back to Judy to kick off the panel discussion as well.
Okay, thanks, Catherine. Can we close that screen of the poll? Or can I close it? Oh, okay, it's gone. Okay, all right. So moving on to some really interesting and meaty discussion points. We're going to first talk to Sandra Macleod, who I've introduced before, who's the group CEO from ECHO. So Sandra, nice to see you after all this time. And we work closely on developing the audit and implementing the audit and the survey, and then working on the results. So thinking about the trust survey we did last year, Sandra, trust in self-care, as we see, is varied widely depending on the audience polled, healthcare professionals and consumers, and also the regions. So I just wondered whether you might want to comment on that in a little bit more detail than I did, about what this means for us and maybe what we should be working on.
Thank you, Judy, and hello everyone. Yes, I think as we saw in the quick online survey that we just did, thank you, Catherine, for hosting that. All of the participants today very much reflect what we see, the strong trust we saw among consumers, actually, in the sectors. As you said in your remarks, Judy, 73%, 74% of consumers having a high regard for the sector. And I think here we had about 83%. So very much on side. I'll unpick a little bit later on where some of the concerns are coming from. But certainly what we saw among what I would call the high-end stakeholders, and these were the over 100 interviews, as you know, that we did with everything from healthcare professionals through to NGOs, through to policymakers, regulators certainly were in there, patient advocacy groups, those that spanned either global remits or certainly transnational remits. Yeah, and it was very much their close observation, close perceptions that we saw over about a fifth of them actively distrusting self-care. And trying to unpick behind that, a lot of it did actually focus on concerns around regulation, which again, I know we'll touch on in a moment. But if I look at what's driving trust, yeah, which I think is really interesting, among consumers, certainly it was very much the issues around product efficacy. So does it say what it's promised on the box? Whereas among stakeholders, it was really issues around safety. Does this do any harm? And that touches on potential misuse, abuse, misinformation, whatever. Again, not we're only dealing with a quarter of our stakeholders saying that, but just something to be aware of, which will lead on to maybe some of the solutions that we're looking at. When we looked at it across the regions, and again, Judy, as you said, very strong recognition of trust in the context in a European sense. So strong regulation, strong information, strong transparency, and obviously also the US, good strong FDA regulations, good clear communications. So those markets were the most trusted overall. And as we get into other markets, Africa, where there's a concern of either lack of regulation or lack of application of regulation, right the way through to Asia, again, there is this concern of the effectiveness, both the presence and the effectiveness of regulation in those markets. So that really does dovetail very well with the concerns around regulation, not in a European or an American context. So it's important to remember that's very regional. And the only other thing that I would bring out on the regional differences, which was really interesting, is we looked at among the consumers, and we polled over 7,000. We also looked at those who were health concerned consumers. And again, there's a high trust, remember, among the consumers largely in self-care. And the most health concerned consumers actually appeared in more what I would call the developing markets rather than the developed markets. So you had, for instance, consumers in India, consumers in the Philippines, very, very, very concerned about their health management. So a huge hunger and an interest in terms of how to better address that. And then you have, in a European context, perhaps interesting just to pull out is France, for instance, very skeptical about self-care and information they're getting around self-care. So the consumers and the stakeholders did have different views, different tensions coming through. And I think that's interesting when we're thinking about some of the solutions to this issue.
Okay, thanks, Sandra. And you touched on this a little bit, but what are the key drivers of trust? I mean, say the three top things we should be thinking about.
Safety, efficacy, and with that, I would say regulation. Those are the three things that I think are really important, the most important things for the sectors. As I say, playing out slightly differently for our consumers, its effectiveness, does it say what it's saying on the tin? And among our stakeholders, the safety, those really looking after the patients, the NGOs, the policymakers, how safe are these products? So those are the top two, but I would add to that this issue of the quality and the standards of regulation in a particular market.
Okay, and I mean, again, you touched on regulation, and I think Manoj will have something to say about this as well. But what we saw in the audit was that where there were, I don't know whether it's more regulations, but just a strong framework that people know works and trusts, and that products are reviewed appropriately as well, that we have a better consumer trust. But is more regulation a good thing, or do we just need to, perhaps in regions such as Africa and Latin America, strengthen the regulatory framework?
Yeah, no, again, that's a very good question. And as the research found, it is this issue of the markets which are not seen to be able to police, regulate, set the standards, are the ones that are of greatest concern. So it is that framework of regulation and that trust in that regulatory system. So the more that the industry can do to support standards that already exist, standards that we know are respected and actually work well for the sector in Europe and in the US, if those can be applied and if we can help, certain regions like Africa, Asia, South America, to apply those standards. It's really the issue of standards and the framework rather than we need more regulation. Yeah, I think that's really where we're coming from on that side. And it isn't just about regulation to drive trust. Again, as we touched on, a lot of things, and in fact came up in our poll today, the issues around consumer education, transparency, these sort of things, again, are very important in driving trust. It's not just about regulation. It's that framework, yes, the standards, the support, yes, but also the things that go with it in terms of the education, the transparency, transparency and the perceived ethics and code of conduct of the sector as a whole.
Yeah, okay. And just another thing before we move on, was there anything that came out of the trust survey that we did that really surprised you as someone who's worked in the area for a long time?
It's when you get down to some of those little things. It's like how hostile France was to certain things, and the comments coming back out of a very sophisticated market, a very developed market, a very active market. There's a lot of choice. That was a surprise. And it's not just in this area, you know, we see it generally. And I think there's certain cultural dispositions, yeah, that affect people and how they respond to things. So I think when looking at these things globally, as we have been, it's also important to take in the elements of cultural predispositions. You know, and if I compare and contrast France and China, you know, we know that there are issues to do around standards and copycats and other kind of products that aren't necessarily as well made as the branded products and so on. A lot of concerns coming through on counterfeit in China, and yet the Chinese market's very trusting, really interested in what's coming through. So again, a completely different context. So I think it's really important to think of the context that we're talking about in order to support the right kind of actions.
Yeah. Okay. Thank you so much, Sandra. And we'll hear from you again when we have further discussion, joint discussion. And Manoj, let's move on to you now. And as you know, I introduced Manoj. Manoj is a leading member of our board and also was the board lead or board sponsor of this piece of work on trust and the trust survey. So it was great to have Manoj on board with that, but also here today. So in your opinion, Manoj, what are the key challenges to building consumer trust in self-care? What do we critically need to do?
Yeah. Hi, Judy. First of all, thank you so much for having me. And good morning, everybody. I'm really happy to be here to discuss this. Understanding the expertise of our other panelists, I guess I'll take the angle of being a company who has brands, right? That's trying to build trust and what that means for us. And I think at the end of the day, you know, it really depends on your region, first of all, right? Because the delivery of OTC medications per region is different depending on where you are. If you look in the US market and you think about trust and belief in brand is incredibly important. When in the US market, 40% of our OTC categories are dominated by private label products, right? And so when you're right there at the shelf as a consumer and you have an opportunity, digital shelf or real shelf, and you have an opportunity to make a decision between two products, and there's a branded product and there's a private label product at maybe 40% or less of the cost, if there's not a trust in that brand, if there's not a belief in that brand, if there's not a trust in the quality of that brand, it makes it very difficult to choose the brand over private label. And so I think it is incredibly important in regions like North America. I think the other important thing, though, is when you look at regions outside of North America, for example, China, where a lot of our OTCs are delivered through the hospital. In those environments, trust is incredibly important, but it is delivered in a different way. It's delivered through the healthcare professional who is making that recommendation in the hospital. And at that point, your trust is probably built upon your science, right? And probably built upon the fact that if you have high quality science and high quality differentiating factors for your product, you're going to gain the trust of the professional in order to get that recommendation. And I would say in EMEA, very similar, right? As you go through the pharmacy channels, some cases you have a pharmacy channel where some of your products are behind the pharmacist, some of the products are out in front of the pharmacist, but either way, there's a higher level of engagement with the pharmacist on many purchases. And so that is a very careful combination of both ensuring your brand has trust with the consumer, but also with the pharmacist. So when you ask the question of how important is it to build trust, I think it's incredibly important, particularly in the game that we play of OTC medications, where private label products are so readily available or other options are so readily available that if you don't garner this trust with consumers and HCPs, I think it would be incredibly difficult for you to build momentum, to gain share, and to win in the marketplace.
Yeah. And Manoj, is this something, say, the J&J example as a company that you're continually looking at? Obviously, building a brand is critically important to business, but I guess, yeah, working on the brand and how you can enhance consumer belief and and trust in the product? Are you always looking at different what's happening, different things, different angles, what you can do?
It's a constant. It's a constant, right? One of the things that's interesting is in brand building, it used to be something that you did maybe on a weekly basis or a monthly basis. You put out an ad campaign and you put it in the marketplace and you see how it does and you build some momentum and then maybe you change it, right? Back in the day, maybe you had one or maybe two advertising campaigns a year. Now, in the world of connected commerce, in the world of omni-channel influence, in the world of all these, somebody earlier mentioned TikTok driving the fact that ibuprofen, what happened with ibuprofen during the pandemic, this is an always on world that we live in. And so this idea of building your brand and building trust with your brand and your products is in fact constant. It is in fact every day. Now in OTC, I believe it, and we believe it very much to be a little bit different, right? We believe in backed by science, endorsed by professionals products. And so we're always trying to win in those two arenas when we win with our consumers. That's a conversation that we're always going to have with our consumers. But you need to be always on. It is not just something that you can live off the equity. Tylenol is an over 100-year-old brand. You can't just live off of that forever. You need to always make sure that you're continuing to build the trust with consumers in that product day in and day out.
Yeah. So that leads on to one of the questions we had about what are companies like you doing to enable consumers to make the best choices? And I guess you touched on it with, obviously, we've got to have the evidence. We've got to have the science backing this product so that people can trust the product. But are there other things that you're doing to help consumers make good choices?
I think, listen, Judy, the reality is for any of us that work in the life sciences industry or for any of us that work in pharma, we all want to ensure that the right consumer is taking the right product at the right time, right? Yeah. And we want safety first, and we want of the highest quality. And I think we're taking several steps around the world, right, depending on what products we're working on in order to ensure that that is happening, right? So when you look in EMEA, we obviously have a Nicorette business in EMEA. And as many of you know, smokers are much more high likelihood of contracting COVID than non-smokers, right? And so one of the really important things to do there is to help our smokers. And we want to save their lives in general, but we also believe that it's important to protect them during this time of a pandemic. And so one of the things that we've been working on is not only just providing the product, but what are the services that you need to provide beyond that in order to ensure compliance? Regardless of the product in pharmacologics, we always talk about compliance, right? And so I think what our consumers are looking for is for us to provide them more of a guidance, particularly somebody on what we call their quit journey in smoking. They need that guidance throughout that journey. And we find it incredibly important that we find unique and ownable ways in which to connect with these consumers and help them on their journey, whether it be things like digital therapeutics, where you're providing counseling on the side while they're trying to get through this, whether it be partnerships with big retailers so that it can be readily available on e-commerce with advice from a pharmacist or a specialist, whether it be our Nicorette Smart Track, which allows you to track how many times you've used your quick mist, right, and ensure that you are compliant and that you're staying with it. These are the things we have to do. And I know that we're talking about trust today, but I think what we're finding is you have to be there for your patients beyond just getting the product in their hand. And that continues to build that trust. So we have examples of that, kind of around the world. If you look at Orsul in India, which is a rehydration brand for us, I don't know how many people are aware, but, hydration issues amongst children is, I think, the second or third leading cause of death of children in rural areas in India. This is a major health problem, and this is a place where we can have major impact. And so our idea and hope is to have impact on that population. Even before selling products, we want to make sure we're taking care of patients. And you have to imagine that if you're doing that and being there for patients in their time of need, particularly in these situations, you do continue to build trust. And these are with, obviously, as I mentioned before, the highest quality, scientifically backed products.
Yeah, no, it's very interesting. So Manoj, just one last thing. Have you seen in your career trust in consumer trust in the self-care industry and OTCs, especially, I guess, have you seen that evolve or change over the years?
Yeah, I mean, I think it was hit on a little bit earlier, right? in the early stages, if you look back in the 60s and the 70s and the 80s, so much was driven by purely your HCP and your trust with your HCP, right? Think about the role that even in markets like the US, right, where you could buy over the counter, the pharmacist still played I think we're in a movement now where it's the measure me movement, where people are managing their own data and their own measurements, where we have more and more patients coming into doctor's visits and telling the doctor what they need because they, did a little bit of research or did Google Doctor, if you will, in order to educate themselves. So it's the measure me movement. It's the self-care, healthcare boom that we know about with more and more information available every single day. And so I think it's actually, if I had to say the biggest change that has not been mentioned yet on this panel, is it's even harder to win that trust. Because that trust is made up of more now. Yes, the science is important. Yes, the backed by a professional is important. But also, what is your purpose as a company? Do I believe and support your company? That is important. What is your sustainability strategy? That is important to me as a consumer now. What are you doing, right? How are you helping those in need as a healthcare company? Right? That is also important. So I think what we're finding is the trust is not as easy to win as it may have been in the past. We have a much more discerning consumer. We have a consumer that is much more educated. We have a consumer that has all the data in the world available at their fingertips. And so we continue to have to work hard to build that back up over time. And, you look at brands like Tylenol and Judy, and I think many people know the story that, unfortunately, due to some manufacturing challenges that we had, in 2009, 2010, we had to take Tylenol products off the shelf in the US, right? And when you do that, we obviously disappointed our consumers and we disappointed our customers, and we had to come back from that. And I think that's an incredible case study. You're talking about a brand that was #1 in the marketplace that went down to a 5 share. And, that brand now today back up at #1. It took us a long time to get there, and we had to work and fight our ways back. But I would argue that one of the biggest things we had to do is regain those consumers' trust and regain those customers' trust. And I would just say it continues to reiterate how important it is in our industry that we have this trust and the faith and the belief of our consumers and our HCPs and our patients at the forefront of everything we do.
Okay, thanks so much, Manoj, for those insights. And again, we'll be hearing from you again. So I believe Chris has joined us. Hello, Chris.
Hi, good morning or good afternoon for some of you.
Okay, hello. Yeah, it's mainly afternoon for us, but I know it's morning for you in Austin, Texas. I did introduce you before, Chris, so we'll get straight into it. In terms of health data in the self-care industry, obviously a rapidly evolving area, and especially with COVID, what are some of the key developments that you've seen in health data in the self-care industry, kind of pre and during and post-COVID, I guess?
Yeah, well, I mean, going back to the white paper, 80% of the responders in the white paper define self-care as empowered patients. But, Manoj, you were a great lead in there, because being an empowered patient is really, really hard. Most of us don't have the proper training to take this data and assess it. A bit of an analogy would be nutrition and food labels. I'm not a nutritionist, so the fact that you're putting a food label on something and telling me exactly what I'm about to eat doesn't really do me a lot of good, because I'm not empowered. I have that data, but I don't know how to act upon it. And so we've seen this evolution of the industry where people are now starting to react. So you originally had apps or tools that were created where you could capture what you're eating, and you had to go through the process of typing it in, and you're capturing more data that way. And then you had food trackers. And then ultimately you got to this notion where people found a company that they trusted, built on the word that Manoj is using, trust, and they would actually send me food based on what I was trying to achieve with my diet. So it's a little bit about this notion of data, and what data do I have? What data do I share with someone else? And how do I trust someone else to then act upon it? We see something very similar going on with the way people are trusting pharmacists. People have data, they don't necessarily know how to interpret it. And so they go and they talk to their pharmacist, and they get that recommendation about what to do. And that guided journey that Manoj was talking about is super, super important as we utilize data. And the final point I would make just about what I'm seeing going on with health data is it's now gone where we actually are seeing bots and AI and Dr. Google and other things that are taking that data and interpreting it. So we've got a much more diverse set of data. We can capture a lot more points along our journey. But the really interesting thing is how people are then acting upon it, because we aren't trained to assess it, but we're picking trusted brands or trusted tools that we're using to help us assess that data, to act upon it, and then helps drive a health outcome. To me, that's the big change in health data right now.
Yeah, no, it's really an interesting point. And, you know, you're part of our health data advisory group, which is fantastic to have IBM on there. So with all that's going on, so much that's at consumer and healthcare professionals' fingertips to help them maybe understand their health choices, if you like. What are some of the key opportunities, but also the challenges in this omni-channel world for health data and self-care?
So I'm going to go back to the white paper, and I mean, some of the findings in it. And the stakeholders talked about wanting to see the self-care industry invest more in consumer education and collaboration and standards and ethics. And we saw that even today in the pop-up survey, when we look at the results that came up a little bit earlier. So I think the real interesting thing in all this, and how do we action it, is people talk about wanting to have more protection of data and the ethics around their data and everything, but then you got to juxtapose that with the fact that people give it away pretty readily. People will talk to a pharmacist that they don't know and tell them something incredibly intimate and personal, and they do it because they trust the pharmacist. They trust the company that pharmacist works for. So as we look at the challenges and opportunities in health data, I don't think the challenge is quite as much in the ethics as sometimes we think it is. I think it's more in how do we action it and use it to change a health outcome. And this is where I think the opportunity is. The opportunity is so many things in health take a very, very long time to transpire. If I'm not taking care of my skin, if I'm not using skincare products, I don't develop some kind of a skin ailment or a cancer in the span of 1, 2, 3 years. I develop it over a decade. If I'm not eating well, I don't get high blood pressure tomorrow. I get it over a series of years. I think the real opportunity in health data is to take the micro moments of where you're making good choices and help people better understand the long-term ramifications. Digital and data can be very, very good at incentivizing us and showing what's going to happen very near term. And I think there's an opportunity to creatively use data and the predictive power that data gives us to help someone understand the long-term journey that they're on, versus what happens today where someone wakes up and finds out that they've got a very serious healthcare issue that has been manifesting itself for a very long period of time, but they never had any of those gentle nudges or reminders or enforcements along the way that they were making good decisions that could have prevented that chronic problem erupting much further into the future. So that's what I'm super interested to watch in with healthcare data and self-care, is how can it be used to reinforce good behaviors that avoid long-term chronic problems?
Yeah, that's a good point. So do you see health data and the use of it, I guess, being able to improve consumer trust, or is the pandemic, would you say, positively or negatively affected this?
So I think the pandemic is going to improve consumer trust. It's that quote, there's decades when nothing happens and weeks when decades happen. We've gone through one of those moments right now. The pandemic has driven a forced adoption of self-care, of telemedicine, of what does my smart scale say? How do I work out without a trainer, but using maybe some kind of a wearable or a digital health tracker, things like that. All of these things have been forced adoption of both technology on one realm where I tend to focus, but more importantly for this discussion today, in healthcare, because you couldn't get to your provider. You couldn't have some of the traditional interventions that you would have had from a healthcare provider. So you had to find new ways of doing it, new ways of exercise. And all those positive steps of people having to own their own healthcare versus expecting someone else to help them with it, I think are incredibly, incredibly useful. Again, people sometimes push back and say, well, is digital or And I think that's really the wrong conversation. I think at this point, the pandemic has forced everyone to kind of get over that hurdle and to say, no, you're going to have to be responsible for your own healthcare. You're going to have to be responsible for your own data. You're going to have to make decisions about with whom you share it, be it a wearable device, be it some kind of a doctor, be it some kind of a nutrition company that's going to send you food. You're going to have to make those choices. You're going to trust the choices you make. And then coming out of the pandemic, you're going to have a new way of taking care of yourself that's much more empowered to all of us as people here on planet Earth versus what it used to be, where you could kind of go to someone and expect them to tell you what to do.
Yeah, okay, thank you. Okay, so now we're going to spend about 10 minutes with all the panelists, and I think David as well, David Ridley. So the first thing I would put to you all is, and David in fact touched on this with the French health minister and ibuprofen during the pandemic, but we saw lots of misinformation, and we saw how quickly it spread. And I'm just wondering, is there anything that we can do to combat that? Thinking of a new COVID in 5 years' time, something else comes along. Can we ever be ready, or do we just have to have our crisis plans ready for when this sort of thing happens? Maybe let's go to you, Sandra.
Okay. Yeah, no, a really interesting question. And I think this issue of what trust and what affects trust is particularly relevant now. As you say, information is moving so fast. People are consuming information and listening to other sources they trust in different ways. And I think, again, here what we saw in the research was that stakeholders trust the scientific papers and the journals. So the more evidence, the more support, the more we can do at that level, the more it'll help shape and influence policymakers and decision makers and healthcare professionals. At the consumer level, we still see, yes, the media's there, but actually it wasn't, they didn't say that it was as influential as doctors, nurses, pharmacists. Yeah, so they're saying I need to go to a professional to guide me as to what I should be looking at. So I think this issue of preparing ourselves for this misinformation and potentially another pandemic, I think everything that supports a broader educational campaign that supports the validity and the integrity of the research that goes to the prescribed ways of addressing it, and this issue of owning your own health, as Chris has been saying, I think is really important. And it's also important to this issue of who do people turn to for information and who do they turn to information? So what does that ecosystem look like? And where does the industry sit there? And so this issue of the one voice, can you all talk with one voice? And it goes above and beyond branded products to a certain extent, to say, actually, this is the right way. If ibuprofen is the right one, then do you have a choice in terms of which ibuprofen you buy? But I think this issue of really focusing on that trusted sources and trusted sources of information, speaking with one voice as much as you can, because certainly what we saw on the media and the social media side is it does go like wildfire. The media, by and large, actually surprisingly picked up a lot of coverage neutrally. They're happy to share information and factually so, but where they are either supportive or negative, they tended to be negative because it's that bad news sells headlines, or that bad news Twitter or shock Twitter tweet, TikTok, whatever it might be, is the one that people pick up and carry. Yeah. So it's actually saying, okay, if those things are going on, people then are now starting to be aware of the dangers of social media. How can we help them be aware of the importance of sound information to guide their decision making?
Thanks, Sandra. Manoj, I'm sure there's something you might want to add to that in terms of how can we combat this misinformation to build trust?
I mean, listen, I think there's accountability on several sides here, right? When health misinformation in the social media space is something that I think that we need to be having conversations with our power partners about, right? And it is something that we actively have conversations with them about. We've had those dialogues with Facebook, with Twitter, with YouTube as well, and now we have it with TikTok. And I think as healthcare companies, and I'm pretty sure all of my partners on the Self-Care Federation board would feel the same way, that we all want to avoid that type of misinformation being put out into the marketplace, not only because of the negative impact that it has on the industry. I don't even think that's the most important thing. It's the negative impact that it has on patients, right? And so in many ways, if you think about the way in which television has been moderated for healthcare misinformation or health information, we need to find ways to do that on social media channels. It's difficult and it's harder to monitor and it's harder to get track of it, but I feel like we're doing a better and better job here. So, regardless, again, just putting the patient at the center of everything we do, it's our job, right? To make sure that we are getting the most relevant and the most accurate information out to our patients. And I think we need to work with our power partners to do that. These major social media channels. And by the way, on e-commerce, it's equally important, right? That when we're putting products up for ibuprofen, we make sure that people know that only certain people should take ibuprofen. When they're taking acetaminophen, we should make sure people know the risks. That should be a part of every e-commerce platform that folks are on, so they know these risks and they know whether or not those risks apply to them. So I think we have a job to do there. The good news is I feel like all of our customer partners and all of our social media partners are willing to do that work. It's just hard work that we have to get done that we haven't done before, but I think it will become incredibly important as we move forward.
Yeah, thanks. And Chris, do you have anything to add there in terms of misinformation?
I think the thing that I would add is there's a difference between being a platform and being an authority. And like if we were to draw a distinction between what, say, the Mayo Clinic puts out about health information versus what Facebook does. Mayo Clinic is an authority and it has an opinion and its messaging is consistent. So if someone says, well, I went and I looked at the Mayo Clinic to learn more about this condition, then you went to a trusted source, you got good information. People then, to contrast that with, say, Facebook, say, well, I read this on Facebook, but Facebook is a platform. It's not an authority. It doesn't have a coherent opinion. It's got a collection of people that post information. And so what we've got to figure out is how do we get people to understand that just because you read it on Facebook doesn't mean that that's what is true or what Facebook believes. Facebook is just amplifying what someone else says, and it's fundamentally different than Mayo. In the eyes of a potential patient, both those are brands and both those are legitimate places to get information. But what they don't understand is that one is only one is an authority and the other is just an aggregator of diverse points of view. And that's where I think Facebook is probably going to have to take a bit more of a stance, saying, no, in certain areas, we can't just be putting out anything that we see. We have to be a little bit more like a Mayo, where it's an authority, where we come to some form of consensus, versus what you see right now, where it's just a collection of opinions, where an algorithm pushes an opinion to my feed based on what I want to hear.
Yeah, I think that's a really good point, that one's a platform and one's an authority, and but consumers might see that they're both exactly the same. Yeah, I think that is a really good point. David, do you want to add anything just from your example of ibuprofen and the issue that arose like wildfire at this, more or less the beginning of the pandemic, and from a kind of a journalist's point of view, your thoughts on that?
Yeah, I suppose we've got an advantage in being a subscription-based source of information. We can go into more depth, and I think maybe with the ibuprofen example, it's the speed at which these things are communicated and then taken up. For example, with that one, the response of particular politicians or even some agencies was very quick, and maybe if there would have been more time, and opportunities to look at longer kind of pieces of journalism, that might have helped. And I think maybe there's an opportunity there, because I think many people are maybe prepared to pay subscriptions for their information, and it's a similar trend to have higher quality information. So that's maybe something that could be seized upon by companies as well in supplying information.
Okay, thank you. Okay, so to round off this part then, I would just ask all of you, just in a few words, what do you believe is perhaps the single most effective way to build trust in self-care? We've touched on these, so maybe you just want to actually say 3 words: regulatory frameworks, anything like that. So again, I'll go to you first, Sandra, in a few words. Single most effective way.
Gosh, if I can say it in one sentence,
Yep.
focus on safety, efficacy, regulation, and actually always underlining the benefit to very stretched healthcare systems currently, in terms of all the educational material that we're putting out there.
Okay, thank you. Manoj.
Yeah, I think I would offer it's kind of science, transparency, and consistent communication.
Great, thank you. And Chris?
I'd agree with Sandra and Manoj, and then I would say the ability for someone to see that their health data is driving the result that they expect. The linkage of, I did this, I took this action with my data, and this is the result I have. When people start to see that manifest in their lives, they'll trust the data, they'll trust the interpretation of it because they like the outcome and it's predictable, it's what they expect.
Thank you. And David, do you have anything to add?
Yeah, I think just good communication.
Yep. Okay, thank you. I think that was a really interesting interaction. So now it is 2:30 and we are going to go to Catherine and where she is going to facilitate the audience Q&A based on some of the questions that have come in that we haven't been able to see, I don't think. But Catherine, I know you've been keeping an eye on it. So over to you.
Thanks, Judy. We do have some questions that have come through, and I just encourage any other participants, if you have additional questions, just to type them in the Q&A, and then we can raise them to our panelists. So the first one, I guess it ties into some of the conversation we had about social media and reporting. So what role, responsibility does or should the media have in promoting trust in self-care? So not publications like HBW Insight, but more national consumer media, which have been printing misleading or unbalanced articles. For example, spreading unfounded concerns about non-steroidal anti-inflammatories at the start of the pandemic. And what can we do to promote responsible reporting? So Sandra, maybe, is there anything that you'd like to add to this one, or any of the other panelists?
That's a lovely, lovely question. I'm sure Manoj and Chris will have experiences as well on this. I would divide it into two camps. I would say, if we're dealing with what we consider the traditional media that you pick up or you listen to on your radio or television, reporters aren't setting out to misinform. And I think this issue of focusing on balanced reporting and objective reporting will always be part of it. And part of that is an educational process. As I say, bad news headlines will always appeal and they'll always be run in those media, and that's their role. They don't have a responsibility not to run bad news. But to understand the context, I think, is important. So I think the issue of being the supportive commentator or voice on those sort of issues is important, and just helping those kind of media channels to say, yes, they can come to the Global Self-Care Federation and, as a voice to provide a perspective, I think is one area here. On the social media side, as Chris was saying, these are platforms, and people talk in their own bubbles, and they will share what they feel is important, is right. And it's very hard to cut across that, other than becoming the trusted source and the trusted voice on that. I'm not in favor of restricting freedom of speech, so it's a worrying area to go down. But I think we've got to understand those are actually two very different universes: the traditional media versus sort of what we see on the social listening side in terms of conversations between people. But I think everything that supports the education and the understanding and the go-to source for backup, can you be the Mayo of the self-care industry? I think that would be something very important to strive for.
Thank you, Sandra. And Chris or Manoj, anything to add on that?
Listen, I think the only thing I would add is that it's a daily exercise at this point, right? Of re-winning your consumers' trust and loyalty. It is different. And it's interesting because, we consider ourselves a healthcare company, not a CPG company, but the CPG environment, the social media environment in which we live in, is not conducive to, the exact types of kind of communications you'd want to have with patients. And the reality is we're not going to be able to change that. So I think in this new world, self-care, healthcare boom, the Measure Me movement, the social media driving my thoughts, recommendations, and feelings on products, right? It is imperative on all of us, and I know that my colleagues on the Federation feel the same way, that we are, as often as we can, reminding patients and educating patients and figuring out how we can be most successful to provide them with the right information to make the right choices. That trust, I believe, is earned day after day because it turns over so quickly.
Yeah, I would only add, I think at the end of the day, it's going to reinforce the importance of a brand and trust, because people ultimately will trust brands, whether it's a brand that dispenses information, a brand that dispenses a product. People will begin to gravitate back to that to sort through the misinformation. And at the end of the day, that's what's going to help pull us out of this, I believe.
Thank you, Chris. So we do have a few more questions up here. So we have another one here. The industry has always had data, often too much. What is helpful to both consumers and HCPs is insights. So how can we help both understand what the data is telling them? Chris, do you want to have a go at that one?
Yeah, and that's it's an interesting tie back to some of my comments earlier, where I really think the key here is going to be, how do we take all this data and then give the average person that maybe isn't trained in healthcare or trained in fitness, or pick your domain that you're focused on in the self-care ecosystem, isn't trained in that, but we give them a tool that gets them to be some level of proficiency. And that could be a digital tool. It could be access to a pharmacist. It could be, access to that trusted person, but somehow taking this data and netting it out for the average person, so they know specifically what is the step I should be taking next to improve my healthcare. That's going to be the big win. I think there's a lot of opportunity for digital tools to do that. I referenced chatbots and AI earlier. I think I've got a tool that I personally use, and it talks to me about my weight and how that fluctuates over time, and if I'm staying in a range or not. And it's a simple chatbot, but it gives me feedback. It does it once a week, and it's super helpful. And I think getting to that ability of making data a series of recommendations and a conversation versus just a list of numbers and a sheet, that's what's going to get us forward here.
Thank you. So we have another question here. Isn't it important to encourage regulators in countries such as Africa, Asia, and LATAM to have regulations that empower consumers? And how can we help to do that? Maybe Manoj, I'll turn this one to you.
Sorry, you cut out a little bit in the middle there. Did you say LATAM? I just want to make sure I heard you correctly.
Yes, yes.
Yeah. So, I mean, listen, for me in LATAM, I think it's a little bit of an interesting market, right? When you go to Brazil, I think it's a little bit similar to Europe, where you have the pharmacy there and you have a conversation that you can have, but it is a little bit more OTC because the footprints of the stores are a little bit bigger. So it's a little bit consumer decision that's happening on its own. For me in that market, I do think that I would love to get more involved in bringing the science forward. I think there's an opportunity for us to bring more of the science forward in that market, for us to partner with local agencies, local federations, even the government on regulation of those products in order to ensure that patient protocols and patient safety is put first. I agree that patient safety, I believe, is put first, but I believe that there's more that we could do to protect patients from making good decisions, particularly in populations where you might have lower literacy rates or lower access to high care quality medication and medical services. I think it becomes incredibly important. So I think the main push that I would make in those markets, and that I know we're trying to work on, is putting safety really at the forefront and patient education really on the forefront of all of our relationships as it pertains to LATAM for the broader population, not for the population only in the major cities that are highly educated and doing well, but for the broader populations in the LATAM markets.
Thank you, Manoj. Any of the other panelists have anything to add to that?
Catherine, I might just jump in and say, Manoj, I guess you talk about consumer education, but it's all included with enhancing health literacy. and that I mean, it's a particular focus of ours as well, but the importance of that. Would you agree with that?
Well, yeah, I mean, I think that was a little bit of the point in LATAM, and I think in many of our markets where health literacy is not where we need it to be. You know, I mentioned earlier in India, the challenges that they have with hydration in young kids. A lot of that is because of access to water. And then a second portion of that is, to your point, the health literacy and understanding and the importance of clean water and taking in clean. I mean, there's just opportunity everywhere, right? And by the way, health literacy is not only limited to our developing and emerging markets, as we used to call them. You know, I would offer that even in the US, in some major cities, we have health deserts, right? Where there is not access to proper care, there is not access to proper education, there is not the literacy that is required. You look at a simple fact, like how many people the ages 65 plus should be really considering, if they're on heart medication, what pain relief medication to take, because some are good, some are not. And we need to really be thoughtful about that, right? But how many people are truly educated on that topic and aware of that when they're making their choices? So health literacy and patient education is a big deal. I think it's hard because it's not something that maybe patients engage in on their own every single day. But I think as companies and as federations, we need to put it more at the forefront of everything we do in order to protect our patients and keep them safe and ensure that they're getting just the proper healthcare, nothing more, nothing less.
Yeah, thank you.
So some other questions that we've received on the Q&A. Is it more important that the consumer trust in a brand or company to overcome the PL threat, or the pharmacist one as recommender of branded solutions? So
I don't know. Yeah, I don't know if there's a single, I mean, I think what makes trust, if we flip that question around and look at the other way, why is Facebook so effective at misinformation? It's effective at misinformation because you hear the same inaccurate point from a series of people. So just as a continuous thread of misinformation forms a belief that's wrong, trust is reinforced by a continuum of people saying the same thing. So whether it's the brand, whether it's the pharmacist, whether it's whatever, it's that perpetual, there's one version of truth, everyone's repeating the same thing. I think that's what leads to true trust. There will be sources that people trust more. Maybe someone wants to trust a pharmacist more, someone trusts a brand more, someone trusts Dr. Google more, and that's fine. That's going to be a personal preference. But what's important to me is that each point, when you go to seek a point of view, that you're hearing something that's roughly driving the same truthful outcome.
Catherine, you're on mute.
Oh, apologies. I just was asking if any of the other panelists wanted to offer a response to that one after Chris's input.
Yeah, it's interesting, and I think Chris is right in terms of, you know, the routes to sources and the avenues and the preferred choices. I think one of the things, certainly from our trust survey, is we didn't see so much this issue around brand versus non-brand, other than the importance of the scientific backed information being shared widely, the fact that as much as it can be done generically and in cooperation with others, this issue of, you know, it's not just our view, it's a collective view across other trusted sources, I think is really important. And I think the greatest criticisms we saw around brands, and they're not, you know, I'll say it probably did not happen from any of the GSCF members, but it was this issue of branded claims and statements that weren't substantiated or were sort of, you know, too extreme or what have you, and there was this concern around sort of, you know, how can they substantiate that? There was also the concern around potential pricing of brand versus non-brand. That was coming through, not a huge amount, but this issue of, gosh, there's always this suspicion of the profit principle versus, gosh, if this product is good for me, do I have to pay over the odds for a branded product? And you get into another kind of conversation. So at the educational level, I think we saw the importance of it being beyond brand in terms of approaches.
Thank you, Sandra. Before I move on to the next question, any other thoughts on that question? Okay. So the next one we have is, do you think that penalties for companies breaking trust of patients and consumers are an adequate deterrent to drive responsible marketing? Maybe Chris, do you want to give your thoughts on that one?
So I think there's about three lenses to look at that one. So one perspective would be back to the Facebook, the TikTok, et cetera. And I think it's very difficult to financially penalize them for not further policing misinformation on their platform. I think there's always going to be some fringe group, or there's always going to be some other platform that comes up and whatnot. I think that's going to be really difficult. I think if you've got a trusted news source, it's easier to go after that and to say, but you are one voice, you're a group of editors or whatnot that comes to a consensus on a point of view. And if you're actively pushing something that is just 100% inaccurate, then we're going to hold you accountable. So back to my analogy of a platform versus an authority. I think you can more regulate an authority. I think it's very hard to regulate a platform. I think the best alternative here isn't so much to go after something from a punitive perspective, but is to try to amplify sources of truth. So perhaps through government funding, since we're talking about penalties, which would be government imposed, maybe there's an opportunity through government grants, government funding to take truthful source information and make them more readily available and to take the friction out of getting to those sources of information. At some level, the reason why Facebook and some of these news outlets are doing so well with misinformation is because people, it's an ad-driven model. So people go to where the most outlandish thing is said, because it then drives clicks, it drives advertising, blah, blah, blah. And I think maybe instead of trying to penalize that, you could try to offset it by government supporting and moving away from an ad model, but moving towards a truth and a pushing messages into the market model. That'd be my recommendation on this one.
Thank you, Chris. So we do have, there's a few more questions that have come up, and also if there's anyone else who has questions, please raise your hand or continue to type in the Q&A box. So quite a long one here. In a post-COVID-19 world where trust in HCPs, especially pharmacists, is paramount in dispelling myths and facts and giving the right evidence based on information, either to consumers or patient, is essential. Can we strengthen collaboration to show partnership in the patient or consumer journey, or even regulatory agencies and patient organizations, tailoring for individual needs depending on health literacy? This is an area where we can make a difference. Fake medicines and substandard medicinal products affect trust in OTC, as well as meds and vaccines and medical technologies. Could we consider strengthening collaboration with the Brazzaville Foundation, for example, or other stakeholders to help get the key messages out? So quite a long one there. Are there any of the panelists that would like to have a go at answering that one?
Just to add another perspective, because it's a good question, is certainly from our research, the area that we saw was most problematic for this area, funny enough, was vitamins and supplements, and in particular supplements. Just people saying, gosh, these great claims are not substantiated, what's behind it, are they fake, are they, they just put in garlic and claim that it's wonderful and so on. So that was one of the areas that people were picking up on and just saying, gosh, transparency, what is it? Is it right? And also, is it fake, is it genuine? So I would just add that to that mix in terms of how one might address it.
And Sandra, you would remember that one of the big things that came out of the trust survey, or one of the major recommendations and conclusions, if you like, that we came to, was that a critically important thing for the Federation to do is to continually work with stakeholder engagement. While we have lots of great stakeholders that we work well with now, that we need to keep building on that and go past the usual suspects and go broader into different areas, including regulatory agencies and other groups. So I think that was a critical thing, and it's something that we're particularly looking at because it was so strong in terms of the research.
Yes, absolutely. Thank you, Judy. And this issue of collaboration and partnerships, I think, is so fundamental to trust, to building advocacy at scale, to actually supporting others with the voice that you have. And we saw it right the way through to not just regulatory bodies and big groups like the WHO, but right the way through to insurance companies who have a view and have an interest in health. You know, so there are lots of organizations who are hungry for really good, sound, objective information and evidence.
I mean, I would add one quick point to this, which is, I mean, I think one of the most underreported stories is the tail end of that question, which talks about substandard products or fake medicines and whatnot. And I look at the work that Interpol is doing and Operation Pangea, where they're going out there and they're really kind of peeling back the fact that organized crime and other elements are behind some of this misinformation and behind some of these fake medicines. I think that's a wildly underreported story. And we really need to have a conversation about what are trusted sources for supplements, for medicines, for information. I just think people are too quick to assume if it's on the internet that it's truthful and you can move forward with it. And we got to figure out how do we educate the consumer that no, that's not true.
Yeah. And if I can just add to Chris's point, I think this issue of guidance, and Manoj, you mentioned as well, in terms of how to address the proper use of products and goods, right the way through to the risks, and look out for. These are things you should be looking out for. If you're going to buy this product or go down this route, look out for evidence of boom, 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 and it can come up in that context.
Thank you. And we have another question here. Do you think embracing sustainability, for example, with product packaging, does this present an opportunity for the self-care industry to build trust with consumers? Maybe Manoj, I'll turn this one to you.
Yeah, I mean, yes. My answer is a resounding yes. I think we have a responsibility in sustainability. I think we face inherent challenges, right? Because if you look at when you have a formulation, it has to maintain its, all of its quality standards for a certain period of time and all different temperatures. And sometimes that's led us to materials that are not as sustainable as we'd like them to be. That might be the case, but that doesn't mean we have to accept that, right? And so if you think about things like product stability, if you think about things like child resistance, which is a big deal, right? That we want to make sure that children don't get access to medications that they shouldn't. These are things that have led us down a path where our packaging is not as sustainable as we'd like it to be. And as I mentioned earlier, I think trust and transparency go hand in hand for our consumers and our patients. I think that consumers are going to evaluate us on our sustainability moving forward. And I think all of us in the industry need to be doing our part, right? So yes, I do absolutely believe that sustainability needs to become part of the OTC conversation. I know that many of my colleagues in the industry are already making great strides there. I know at Johnson & Johnson, we're working hard also in order to make strides there and make progress there. There are some, hurdles to overcome. As I mentioned, product safety, product stability, and product quality are paramount, right? We want to make sure we deliver that. But how can we do that and do sustainability at the same time? That's what we're trying to work through, and we're committed to it.
Catherine, can I add to that?
Of course.
I love the question, and I'm glad it came up because I did want to touch on it. I think certainly, one of the things we saw from COVID is COVID's just been a great accelerator of everything, tech accelerator, right the way through to increasing focus on, how we treat each other as human beings, our employees, our colleagues, but also climate change and sustainability generally. And it certainly wasn't pushed to the back burner, which I know people were worried about at the beginning of COVID, saying, oh, everything's going to slip. Well, it didn't. Everything accelerated. But I think with where we're seeing now, and I think the opportunity for the self-care industry, it's very much the call to action that the WEF has just come out with, and they've talked about the global priorities around, and they've said to public health and environmental stewardship And this is really the opportunity for business to actually, state its role in terms of societal's interest for the benefit of the population as a whole. And this is such a great space for the self-care industry. So I think this timing actually works well for the sector.
Thank you, Sandra. Chris, is there anything that you'd like to add here, or I think we've time probably for another question.
No, this is a bit out of my core area of expertise. So I'm going to defer to our two other panelists on this one.
Okay, thank you. So now, difficult question. With all of this, why is it that issues of trust still persist in consumer health?
Okay, Manoj will have tons of really good close observation and experience here. But I think what I would just, if I can set the context for this, and I think we touched on it a little bit in our panel today, is over time, and we've seen this as researchers in trust and reputation, is we've moved from a period of deference and acceptance, and if the government says it, or my GP says it, or what, I will accept. We've moved from that period to a period of basically my default is mistrust and skepticism. So very much to Manoj's point, trust has to be earned, one transaction at a time, one engagement at a time, one communication at a time, because we have moved that pendulum for a whole lot of reasons, has moved from, we used to be deferential 20, 30 years ago. Generally, we are not, and every indices that we see around trust is that trust is low. But again, the context around this is, don't forget, we are not dealing with huge negatives on trust among consumers. 74% are out there saying, yes, we trust the sector. It's just the question of what drives this. How can we support it? How can we work with it? And how can we work with stakeholders that we know are so influential in this arena? But it isn't just this issue of trust isn't just specific to consumers in self-care. We see it across all sectors, but we have to understand the context that we're in here. Manoj, you're dealing with it day to day.
Yeah, I mean, listen, I think some of it is warranted, and let me be careful on why I say that. The more information that you have, whether it's buying a toaster, buying a washer or dryer, buying a car, the more information you have, the more discerning you're going to be about that choice. And I think the information superhighway that has been built around every single consumer allows them to have more information on the decisions and choices that they're making. And when you have more information and algorithms and social media are telling you certain things, most likely the things you prefer to hear, you have to understand that that's going to influence the way that people feel, the way that people think. And when you have more information, when you have a more discerning eye, when maybe you're only seeing one side of the story, you start to not have trust, right? And you start to not trust as easily as you may have in the past, right? I mean, if you talk to doctors today, the way that patients come in, even, we have obviously an oncology business, they come into an oncologist around the world armed with their information about what they should do for their cancer, because they, spend a little bit of time online. And that's not to say that they're not truly educated, but there inherently is a feeling of lack of trust. So I need to go and figure out on my own because I have access to it today, right? And so this element of what the social dilemma, if you want to call it that, and all of the information that's available, has created a lack of trust in many industries and in relationships and in many different aspects of life. And so as we are here in the healthcare field, as we are here in order to serve and make sure our patients are healthy and safe, as we are here to make sure that the products we provide are backed by science and endorsed by professionals, it is inherent upon us to be out there with the message more transparently, more honestly than ever before. I mean, as an advertiser, Chris, to your point, I have a choice as to whether or not I want to be on TikTok if I feel like they're handling misinformation the right way or not. I have a choice to be on Facebook if I feel like they're not handling misinformation the right way or not. And at Johnson & Johnson, we have made that choice in the past. We have directly partnered with Facebook on health misinformation as it pertains to COVID, and they've been a good partner on that journey. We have held off on being on TikTok until we felt comfortable about the quality controls that were in place and the safety controls that are in place. So we do have some level of control, right, in terms of where we show up. But as an industry, I want us to partner together. As an industry, I want us to face into what is the reality for all of our patients, that they are getting a ton of information from all over the place, some of it good, some of it not good. They're getting a lot of different messages, and it is incumbent upon us to put their health and safety first. If that is our desire, if that is what we are trying to accomplish, then we need to take on that responsibility. And as I mentioned earlier, Catherine, it's a bit of a daily battle, right? Unfortunately, you might win them today and then they get a new article tomorrow and they feel differently, right? So it's an ongoing battle to win that consumer's heart, mind, and in this case, to win their trust.
Thank you, Manoj. Some interesting discussions there, and I think that brings us to the end of the Q&A. Judy, I'll turn it over to you for any concluding remarks.
Thanks, Catherine. I hope everyone got as much out of this session as I certainly have, and I want to thank again HBW Insight for being our partner on this webinar, and also, of course, our speakers, Manoj, Sandra, and Chris, and David, for giving their time. And so just a few insights from the end. We saw in the poll that people on this webinar, 83% trust the self-care industry, and about 63% thought that COVID-19 had enhanced perception of trust in the industry. And some of the most important things in terms of enhancing trust that came out in the third question: ethics and regulation, and having strong regulation in terms of enhancing trust. Some other just quickly key points: the importance of health literacy, that we need to work together to enhance health literacy and improve consumer education where needed. And certainly we're working on a strategy for that. But as Manoj says, this is a global issue. It's not just in African regions or less developed economies, if you like. It's all over the world where there is a problem with health literacy, and we need to work together on that importantly. We're in an omni-channel world, we know that, and we're always on. Everyone is always on, and building trust is a constant thing. It's not just let's do a few campaigns a few times a year. Everyone needs to be working on it all the time, and it is about the right consumer taking the right product at the right time. And if that happens, I think we can really help to move the needle, if you like. And again, we're in the Measure Me movement for consumers. So much happening that it's hard to get the space and the time with consumers to build trust in the right way. And consumers are also very savvy, mostly, or a lot of the time. And they also want to see what else industries and companies are doing. And what are they doing in the environmental sustainability space? What are their policies? Okay, they don't have any policies, they're not doing anything. I think I'll go to another company for my for whatever products I need. And I think in terms of health data, some really interesting things in terms of COVID-19. We saw it's driven the forced adoption of self-care practices, not a bad thing, especially things like telemedicine, and highlighted the need for people to become active self-managers of their health. And I think I said that in the beginning, that really is what we're all about. But I think Chris brought up a really important thing about platforms and the authorities, the health authorities. So Facebook being a platform, Johns Hopkins Medical Center being an authority, but in the eyes of the consumer, there's no different. Facebook says it, Mayo Clinic or Johns Hopkins said it, it's the same thing. So I think they're just some of the really interesting things that came out. And then when we got everyone to comment on really what are the big drivers, what are the important things in building trust, safety, efficacy, strong regulations that are underpinning what's happening, the underlying benefits, showing those, communicating to consumers and healthcare professionals, good science backing up everything that we do, and transparency, and that health data is driving the result that consumers expect. So they're just some of the key highlights or insights, if you like, that I took from the session. So again, I'd like to thank our panel, our speakers, and everyone, all of you, for joining. Thanks so much, and please join us next time.
Thank you, Judy. Thank you, Catherine, David.